Good morning, everybody, and welcome to the Personnel Committee meeting. For the record, it's Thursday, the 2nd of November 2023. I'm Councillor John Evans, chairing the meeting, and I'd like to go around every person to introduce who they are and in what capacity. Thank you. Starting with yourself, Paul.
Thank you, Chair. Paul McLaren, Legal Services. I'm here to advise the committee if necessary.
I'm Cole Ward, Occupational Health and Wellbeing Manager.
Head of HR, Anna Ashmore, Strategic HR Manager. Sarah Clark, HR Officer.
Very good,
Sue Robinson.
Councillor Goldflash-Noas.
Dominic Monaghan, Democratic Services.
Thank you all. So we'll make a start. Do we have any apologies?
We have apologies for Councillor Eyre and Councillor Smith. Thank you.
Chair and also Councillor Amin.
Amin, yes. Everybody else is here, huh? Super. Any declarations of interest? Okay, item 4. We'll move on to the minutes of the meeting held on the 14th of September 2023. You will need to go through page by page, or is everybody happy with those minutes? Any comments? Okay, those minutes will be taken as read then. Thank you. Okay, item 5, colleague health and wellbeing update and Q2 attendance management performance. I believe that's going to be Cole Ward and Adele Ashmore. Thank you.
I'll start it off. It's a standard report that we bring to Personnel Committee on the Q2 attendance management and occupational health and wellbeing. We're asking the committee to note recommendation 2.1, the health and wellbeing offer that the council puts forward to colleagues, and for colleagues to take personal responsibility for their wellbeing. At 2.2, to note that public health has identified the spread of a new COVID variant, which has led to a rise in cases in Derby City. Whilst the national guidance has not changed, a supply of lateral flow kits are available for colleagues from the Council House and Kedleston Road to try and minimise that spread within the workplace. And to also note at 2.3, the Council's attendance management performance for Q2 of 2.96 FTE days lost, and a year-end forecast of 11.32 days lost for 23-24. That's against the target of 10.5 FTE days lost. So in terms of the supporting information and going to the 4.2, in terms of our occupational health and wellbeing approach, I'll hand over to Carl to transform me with that.
Thanks, Del.
If you could just stall for 2 seconds. For the record, Councillor Alison Holmes is present now. Thank you. Good morning, Alison.
Good morning.
Yes, we've noted.
It's a bit about rising COVID in the city. So,
Okay, yeah, we'll continue the meeting. It's fine. Are you okay to take questions? I'm quite happy to keep this open. Yeah, continue, Councillor.
so how widespread is it, or is it just a caution?
Unfortunately, at this moment in time, we don't have the specific data. We only have information provided to public health when somebody does take a test and upload it to the site. So whilst we haven't got any specific cases in terms of data for you for this report, we also as a council at this stage, because the national guidance hasn't changed, don't record any COVID cases. So we don't have anything specific to give you, I'm afraid, Councillor Carl.
Happy to tell you, Cole.
No problem. So apologies, wasn't present at the last meeting due to other commitments, so it's great to be back to explain the occupational health and wellbeing approach. So Personnel Committee have regularly received updates about the ongoing work of the OH and Wellbeing Service and the continued development of the Council's health and wellbeing approach previously. So as you know from previous reports, Council provides in-house doctor-led service. Now I want to make the committee aware that we've recently exceeded our service level agreement by 2 days. So our service level agreement is 15 days seen within the space of a referral. We currently, in the month of September, extended that to 17 days and that was due to the second paragraph, which I'll explain now. So the referring managers were supporting colleagues through the OH referral service, which had an impact on clinic times and resource. We have managed to support these colleagues who have had trouble accessing NHS or GP support and are now back in target. And just to expand on that a little bit, because our occupational health doctors or previous GPs, so we have been able to support them. So rather than waiting for doctors' appointments or NHS appointments, we've supported them, which has had a knock on to the service level agreement. The occupational health service is now back on track, so it was only the month of September, and it's delivering against service level agreements within the 5 to 10 days of receipt of a referral. Great news, we've recently supported our colleagues through World Menopause Day. So we've also arranged for a menopause practitioner from one of our partner organisations in the NHS to do a session on a question and answer for further support for our colleagues. It is something that we're taking very seriously at the moment, and we're pleased that the uptake has been really well received. An integral part of our wellbeing offer is the EAP programme, which is externally hosted. Colleagues can access information, as you know, on a range of health and financial matters 24 hours a day, 7 days a week. And at the previous personnel committee that wasn't at, we were asked to clarify the percentage usage numbers. So I can confirm that the usage figure of 4.5% is of the total workforce, so it's not people who are off sick. It is anybody that needs to reach out for any support, whether that been them currently off work or within work capacity and working. And that equates to 145 people accessing the counselling sessions available. A total of 10 new counselling sessions were open in August and a further 6 in September. And to note, as we did previously, the People Services Directorate remains the highest user of the counselling service out of all sessions during the period August to September, and that's not changed. The average take-up remains at 7, again, that's not changed. And the most popular format for the session, again, was telephone consultations. The top 3 reasons for accessing counselling across the council, all council directorates, were anxiety was number 1, women's health was 2, and family 3. Personal issues accounted for 68% of access, and work-related issues accounted for 32% of all access, which is a slight decrease on the last report. The last report stated that we'd seen an increase in work-related issues. That figure's now reduced. And headline figures, just to make you aware, levels of take-up are shared at directorate level. We don't know any further below that. The focus continues again with managers from the People Services Directorate to understand from a HR business partnering approach what actions can be taken to understand and address the level of absence and our employee assistance programme usage numbers. As services continue to focus on relevant actions to reduce the absence level, an analysis of average working days lost due to sickness absence is currently being carried out. That continues. And this may relate to an increase in counselling sessions. We've not seen that yet, but it may well do. Yeah. We've formed the Wellbeing and Attendance Group, which I've mentioned before, and that's going to focus on trends and supporting managers through education, peer support, and ensuring accountability on managing absence effectively. This group has representatives. It's myself, occupational health and wellbeing. We have HR colleagues. We have performance colleagues, and we also have heads of service to ensure support and consistency when dealing with absence. And we're currently in the draft stages of our wellbeing strategy, and we've recently headlined the priorities of the draft strategy at the council's recent managers conference. And I'll come on to that a little bit later. So over to Adele.
In terms of the COVID new variant, we are encouraging all colleagues to practice good hygiene, including the covering of mouth and nose when sneezing, and encouraging staff that are eligible for vaccination to take this up. In cases of COVID, if they do increase over the autumn period, as we don't record cases of COVID, there would be likely to see an increase in the number of coughs, colds and viruses that are associated with that illness. In terms of 4.4, the attendance management performance, you can see there that the Q2 result gives us a year-end forecast of 11.32 FTE days, which will be 0.82 days higher than the year-end forecast of 10.5. And you'll see there that we've left on the Q1 breakdown across the council in terms of FTE days, and also show you the Q2 from the May to September, where we can see chief executives at 3.50 days lost and a year-end forecast of 7.71. We can see people services at 5 days lost and a year-end forecast of 11 FTE days. And we can see that plays has 5.72 FTE days lost and a year-end forecast of 12.59. The top 3 absences for the Q2 was again and the same as Q3, stress anxiety at 21% of all absences, followed by musculoskeletal at 16% of all absences, and then again post-operative recovery and other hospital treatments at 8.32% of the absences. And again, we can see that the largest increase was the NHS, obviously carrying out now the backlog operations, where this increased from Q1 at 6.87. So we can see there that there hasn't been a massive increase in absence from the Q1 to Q2. And at the last personnel committee, you asked me to put together some people services data for you in terms of a bit of a deep dive into the absence reasons. I've provided you there with the headcount in the period for Q1 and broke that down by the headcount of people off sick, showed you the short-term absences of 108 and the long-term absences of 55, and then broken down of the 6 directorate areas with that each of people's services, because it is a big service area, broken them down and showed whether or not the areas within each of those areas are either over or under targets. See also the top 3 absence reasons. So from there, you'll see that there are a total of 37 areas across people services. And this data that I've pulled together on this report is the information taken from the HR dashboard, which is provided at the end of each quarter, that's shared with directors and heads of service. This is a small snapshot of the information I provided you with on the report today. And this information is then fed into the service area action plans that are taken forward. So it gives you a little bit of a feel of the information that is being shared across with managers, and the HRAs. And we also include on there all the HR data for them in terms of starters, leavers, turnover rates, because they all form part of the picture as to why we could have a particular issue with attendance. So at the time of compiling the report, unfortunately, I only had the Q1 information for you. So Q2 wasn't available at the time when the report had to be put together. But we received that on a timely basis from the HR data management team. So in terms of 4.5 and future focus for 23-24, Paul?
Yeah, thanks, Adele. So again, expanding on this a little bit from previous committees, focus throughout the remainder of 23-24 is defining our wellbeing strategy, as this will form an integral part of our council people strategy. The recent established People and Culture Programme Board will oversee the development and implementation of the strategies, underlying the importance of positive health and wellbeing for our colleagues. Our prevention-focused wellbeing approach supports our vision of ensuring that health and wellbeing is embedded in everything we do and championed at all levels. That's really important across all functions as well, so that positive wellbeing becomes part of the culture. We recognise that wellbeing does not start and end in the workplace, and we want to empower our colleagues to make informed choices and engage in positive health and wellbeing behaviours so they can thrive at the council and beyond. And we will build on the work that we've been doing over the last 12 months to support colleagues to make these informed choices. And you've already seen the bullet points, but I will go over them again because I think it's important to stress the wellbeing activity calendar. And Councillor Evans, you mentioned as previous committee around looking after diet, nutrition. It's really important that we're looking at expanding with our partners at the NHS, and the wellbeing programme is really exciting. I'm hoping to bring you more news early next year, but it's really exciting stuff, and it's a wide range of products. So I'm happy for wide range of products. Happy for any questions on that. But we are still in the development stages. Provide appropriate guidance based on national campaigns and relevant research in line with our NHS partners too, and provide the support and tools needed to make healthy choices so that our colleagues can continue to take personal responsibility for improving their own health and wellbeing, and understanding that we're there to support them as well when they need the support. In addition, I think this is really important, services will continue to focus on relevant actions to reduce the absence levels, and an analysis of average working days lost due to sickness absence has been carried out, looking at our local data and within the national context. This will be continued and discussed at the next wellbeing and attendance group, which has got the representatives of, as I said earlier on. But happy to take any questions later.
All right. Councillor, any questions? Councillor Khan.
No. Has health and wellbeing made any difference if you recently, when you started working from home since the COVID? is the figures decreased or increased?
On the absence figures.
Yeah.
So we've noticed absence decreases in some areas and not in other areas, because we have certain people that can work from home. We've issued the hybrid working statement, and we've got colleagues that unfortunately with MSK issues that have to have time off if they're off. So in some areas, Councillor Khan, yes. In other areas, no, we haven't seen that.
Other questions, councillors? Councillor Bonser.
Thank you for your report. That all sounds really positive and exciting, you know, in terms of the plans for next year. Just going to the additional information that you provided around people's people, correct? Looking at the different stress and anxiety to feature, you know, hugely as a reason for absence, and you've identified that around a third of those cases are work related. To what extent can you sort of unpick that when people come back to work, and what are we doing to support those people?
Well, we're part of the action plans for those areas in terms of where we have stress-related absences. We encourage managers to have those early discussions with colleagues to identify the stresses, whether they are personal, work-related, and what ordinarily happens is somebody has a personal related stressor, and then the final straw, one thing at work, then will cause them to be absent. So we encourage managers to pick that up. We look at putting wellbeing support plans in place for those colleagues so that when they return and can feel safe to return to work, we, as part of those support plans, there are actions there specifically that could be for both the colleague and for us as the organisation to take forward. And where we have just stress as a reason, we are encouraging managers to have those early conversations with them to identify what and how we can help, even with the EAP service recommending to occupational health. So we generally do as well have some cases where if they could be linked, for example, to an existing HR process. Now, those are harder to encourage somebody back to work.
And are the managers trained then in identifying those stresses? And do the managers receive any training?
We do, yes, they do.
Do you want me to add
Yeah,
to that?
that'd
So,
be helpful.
Councillor Bonser, I've got some information. So part of the programme and the research we've done has identified areas of the stress, anxiety. We know nationally, whether it's Derby City Council or elsewhere, there is probably cost of living, there's everything. Okay, the backlog of NHS, the pandemic. So we're recovering from that. The research that we've done will focus on specific courses for colleagues, for managers. We have a resilience is key for me with the issues that Adele's outlined, because stress comes in all forms of, it's getting to the bottom of what's causing that stress and then tailoring the support.
That's right. I mean, it's the root cause, isn't it? You know,
Correct.
to work with all of these measures that you outlined that, you know, in terms of wellbeing going forward are really positive, but we've still got to get to the root cause. And also looking at the figures around overall absence in that area at over 10%, you know, whether workload features on that as well. Because are those, you know, the 10 or 11% of people that are off, are they being covered? Or is that just increasing other people's workloads? So
Stressing those other people.
And that's something the Wellbeing Attendance Group will be
Yeah.
provide. So
thank you. It's all
Yeah.
very interesting. Thank you for it.
Yeah, good points. Thank you, Councillor Bonser. Any other comments, councillors? Or Councillor Holmes, just wanted to say, are you okay with the minutes of the last meeting?
Oh, yes.
Thank you. Yeah, just in case you had any comments, I'd be happy to revert back and go over them. Yeah, I noticed, if I can say a few comments, you've got bereavement mentioned in there as well.
See, that will come out when there's a very small team.
Yes, that's what I was going to
Yeah.
ask.
Could be one individual person within a team area.
Yes, otherwise, if it's not, then I'm thinking, got all these
Yeah.
bereavements. Yeah, that explains that. Right, so if we can move on then, everybody's happy with that? So we'll move on to item 6, market rate supplement policy update, school support. staff policy, and that's going to be Nicola Gerard, isn't it? Thank you.
ECC Central market rate supplement policy to this committee, which you can approve. So this policy is identical in nature. The changes that we made everything are identical. The only thing that we changed with this one is to put it in the format for schools, so it has different responsibility, roles and responsibility. Therefore, it will include to be honest, and obviously with the glossary and everything, the terms are slightly different to schools. But apart from that, it is actually identical. So I haven't got an awful lot to sort of go through if unless you particularly want me to, or if you have any questions. Again, the expectation is that the market rate for schools as well as DCC Central is that it would be, used as an exception rather than the rule. And yes, any questions?
Any questions, councillors? Yes, Councillor Monster.
Yes, just a couple. On the recommendations, you're talking about the rollout of the changes will be shared via the school's information portal.
Yes.
And a communication rollout will be shared with colleagues. When you say colleagues, I'm assuming you mean support staff.
Yeah, that's correct. Yes, that's
how are those changes in policies communicated now to colleagues in schools? How is information fed down when the policy changes?
Okay, I believe
we have the school business manager meeting, which a HR lead will attend that meeting to inform them what policies are coming up, and then what policies are being kind of looked at and worked with across the schools and the schools trade unions. We then have the schools newsletter as well, which we produce on a termly basis from HR. Which is one specifically then that shares the information with what we encourage that to go on the notice board so that all colleagues can see what's happening in HR, which includes the policy updates and developments. The policies also get sent to the school business managers and the head so that they have an accountability to disseminate those and either get acceptance sign up to those policies or not, depending on the nature of the policy that we're sharing. So we have a communication plan that we carry out for each of when a policy goes into school, and it gets uploaded on the SIP. Sorry, Councillor Bonson.
Yeah. If I could perhaps just add, Chair, as well, exactly to Joe's comprehensive answer about the communication plan. Obviously, we also, as you appreciate, consult our trade union colleagues when we're changing the policies, and also our trade union colleagues are great advocates also of sharing the updates in the schools as well, that complements our communication channel. And we are actually the school business manager meeting later this month that will be out. So subject to the committee approving the policy today, if they do chair, this would be an update that we would share at that school business manager meeting as well. It's happening.
Sounds like the information is disseminated in an expedient manner in a number of ways. Yes. I wanted to ask, if that's okay, how many people roughly is this affecting schools? Roughly, I know it's going to fluctuate, but across the city.
Yeah, well, this is just for support staff.
Yes.
But as it stands at the moment, we don't generally have market rate supplements in schools. There hasn't actually been a policy for market rate in schools at this point. But as we're now doing new policies, we're ensuring that schools have access to a policy as well. So again, councillor members, I don't expect it to be used frequently.
No, the form's there in place.
In place if they
Sure, understand. Yeah, Councillor Bonser.
Just one further question on the equality impact assessment. It's saying that gender monitoring will be carried out to ensure there's no indirect sex discrimination as a result of applying policy.
Yes.
Who will do that, and who will do that if the school doesn't have Derby City Council HR? Who does that gender monitoring?
So that would be the school, but we would provide advice on that because the market rate assessment would come through to the City Council. So we would to work with the school councillor Bonson to ensure that takes.
So you have overview of every case of where there's a market rate supplement. You as the HR team within the council would have an overview of that, irrespective of who provides the HR support in the schools, because a lot of them are external, aren't they?
As part of our communication, we would be advising the schools, subject to this policy being agreed, that if as Nicola said, we don't anticipate.
No.
But if there was a need to consider a market rate supplement, that the school would, where we are still the employer in law, that the school will be working with us. They take the lead on before the proposal. Be working with some aspects of it.
Yeah, absolutely. As part of the guidance, there is a step that it would still come to us to do that, risk analysis and to look at all of that. So that gender marking we would be looking at that as part of that.
I mean, I think that really needs to be hammered home, doesn't it? Because otherwise there could be a risk there.
Absolutely, and that is what we would be looking at.
Yeah, especially where there's external HR. They should all just use your own.
Any further comments or questions? Councillors? No. What? It's a short meeting then. I think that concludes the meeting.
Sorry, just we can just formally.
Oh, formally approve it. Yeah. We didn't do that for item. For item 6, we will formally approve it so it can be correctly ratified. Just go back to the right page. So I'll read them out. It's the recommendations at 2.1 and 2.2. 2.1 to note the proposed main changes to the revised schools market rate supplement policy as set out in the supporting information section, which is Appendix 1. And 2.2 to approve the revised policy, Appendix 1, and to note that subject to this ratification, the revised policy, application form and guidance will be published on the school's information portal and the communication rollout of the changes will be shared with colleagues. Is every councillor happy to support that?
Yeah.
No objections? No. Yeah. Okay. It's carried. Thank you.
Sure.
That now concludes the meeting.